Hi, Tom.
Hi, Samantha.
How are you?
Okay, looks like we've got a few people already. I think I see Marcia on here.
I think that's her, yeah.
Okay. And Ben is here.
I guess I was muted. I think I'm unmuted now. Can you hear me?
Yes, we can hear you,
Oh,
Marcia.
good, good.
Welcome aboard.
Thank you very much.
I tried to get my camera set up right for this meeting so I could actually have it on, but for some reason, when I turn it on, I'm upside down and I cannot fix that. So I think I might just have to have it off, Tom. I'm sorry.
Well, you were right side up on the news tonight, so.
Well, I wasn't at first. When she started recording, I was upside down too. And then we had to plug in a separate camera and flip it upside down. It was so weird.
Okay.
There. I got my video going.
Okay.
So Samantha, were you on the news tonight?
I was. I haven't had any time to watch it, but I was. Yeah, KCRG.
Oh,
Yeah.
okay.
Yeah.
You're upside down still.
I know. I'm gonna see if I can flip it, but I don't know why it does this.
Well, don't do that. You never know what's going to happen.
Oh, there you go.
Okay.
There you are.
Perfect.
Perfect.
That was weird.
Okay, you did get home, huh? Amy. Sandra. Did Bailey get to Des Moines today, Samantha?
She did. Yeah. I think she's still on her way back now.
Okay.
Yep. She had a septic training. She said that she was the only woman there. It was all male septic installation companies. So I think she was a little intimidated, but I heard it went well. So.
Okay.
Good evening, everyone.
Hi, Sandra.
Hi.
How are you?
I'm good, thank you. How about you?
I'm good too.
Ready for the cold night?
I live in a really old house that has old windows, and so it is impossible to keep it warm. It's
I'm
freezing.
sure.
Yeah.
I think the wind chill is supposed to be like 20 below tonight or something.
Oh,
So cold.
yeah.
Well, we had propane delivered yesterday, so we should be okay.
Oh yeah, mine came too a couple days ago, so. Thank goodness for the contract price.
Yeah.
Can you guys hear or see me?
Both.
Oh, good.
Welcome.
Because thank you. And thank you for reaching out, Sandra. Thank you. I have,
Hopefully there'll be a lot more.
Yeah, yeah. I have to play around with how my computer is between viewing the documents and viewing everybody else.
Oh, yeah. Mhm.
It's a learning curve a little bit.
Read it quick.
That one doesn't get to vote.
Rita wants to come to the meeting.
Oh.
Well, back from Germany.
Hello.
Hi,
Hi,
Sandra.
Hendrik.
I think I heard that Adam is going to be about 5 minutes late.
Hello, everyone. I'm Mark. I'm just having my dinner, so I'm going to not show my face.
Okay. And I see Jess Smith is on. Hi, Jess.
Hi, Tom. How are you?
I'm good.
Good.
Okay, I have 6 o'clock. And by the looks of things, we have 6 from the Board of Health on the call. We have Marcia Horwitz, Amy Crow-Sunleaf, Sandra Larson, Hendrik Schultz, Jess Smith, and Tom Beschen. We are waiting for Adam Hoffman, but since we already have a quorum, I'll call the meeting to order. So at this point, I would invite any member of the public who has anything they wish to address the Board of Health on that appears on the agenda to raise your hand on Zoom. You will be recognized and asked to unmute. You will have 3 minutes to make your comments. So is there anyone on the call that would wish to address the board on items that are on the agenda? Diane Pape-Freiberger, you have 3 minutes. Please unmute yourself.
Thank you, Tom. First, I want to thank the 2 new members of the Board of Health and all the Board of Health for continuing to serve the health of the community. And congratulations, Samantha, and I'm looking forward and I'll be watching for all the great things you're going to be doing. Thank you. That's it.
Thank you, Diane. Okay, Ann McDonough, you have your hand raised. Please unmute yourself.
Thank you. Good evening, everyone. Basically, I just wanted to address an agenda item that is going to occur before I would be able to give any comments as the liaison to the Board of Supervisors, and that relates to the mask purchasing. I just wanted you to know that this week, actually just yesterday, I dropped off to Eagle Grocery Store and to Walgreens on 22nd Street, the last of my masks that I have dispersed here from home, whether they're Board of Health masks or County Supervisor masks. I understand that we are out at this time. So I just want to encourage you to, without any masks in the community, the rescue mission reports to me, and I've delivered there recently as well, they're using 60 of those disposable masks every day. And the Eagle grocery folk and the people at Walgreens told me that we have citizens that are still asking them for masks. Again, they're the disposable kind. So I think that that intersection between what we're putting into the community is still certainly not as the volume that we were once doing, but there are people asking us as a health department and a county to provide that. So when you look at that, I would just encourage you to know that I personally don't think we need to be real conservative, but we probably should have a supply of masks. So thank you.
Thank you, Ann. Okay, Mark, please state your last name.
Zugenbuehler. Spell that for me.
I don't have to.
I'm kidding. So I would just like to say thank you very much, Ann. I am the nurse at Marshall School, the registered nurse at Marshall School, and that is my area of concern, and I do thank you for that.
Okay.
That's all.
Okay, thank you very much, Mark. Is there anyone else? I don't see. Okay, all right. Seeing no one else, I would like to move to the next item on the agenda, and that is the introduction of new members. So with, as Diane Pape-Freiberger already mentioned, we have two new members joining us tonight, Marcia Horwitz and Jessica Smith. I would invite Marcia and Jessica to give a brief introduction to themselves, and then the rest of the board will go around and give a quick introduction to those two. So, Marcia.
Okay, I'll start. Hi, everybody. It's a pleasure to be here with you. I'm a Chicago native. I moved to Dubuque in 2000. I'm a retired neurologist. I practiced in the Chicago area for about 20 years and then joined Medical Associates Clinic, Department of Neurology, and had a really enjoyable career there. I have 2 adult sons, my husband, my dog, and we've enjoyed living in Dubuque since 2000. My kids more or less grew up here, and I retired in September officially, and I am now interested in working with different organizations in the community, and so here I am, and it's a pleasure to be a member of this board.
Thank you, Marcia. Jess.
Yes, I would echo Marcia's sentiments. I'm appreciative to be a member of the board. I am Jess Smith. I am born and raised Dubuque. I obviously went away for college. I went to pharmacy school at the University of Iowa and then did my master's in public health there as well. And then moved back to Dubuque in the last maybe 10 years to raise my family. I am currently the pharmacy supervisor at outpatient for Mercy One, and have done a lot of work most recently, obviously with COVID vaccines and the COVID pandemic. But I did a lot of work with public health kind of when I was in grad school, primarily focusing on rural health, mobile clinics, and smoking cessation in Southern Iowa. So I am a mom to 6 kids, ranging in age from 12 to 4 months. And I'm just thrilled to be able to give back to the community in this capacity. So thank you.
Okay, thank you, Jess. Okay, I'll start. I know Jess, but I don't know Marcia. So, Marcia, I've been on the board since 2000. This is Tom Beshan, excuse me. I've been on the board since 2015, acting chairman for the past 3.5 years. Prior to that, I retired from John Deere in 2010 and spent 38 years there. I'm native Dubuquer, so I'm giving back to the community for the long life that I've enjoyed here. So thank you. Thank you for joining us.
Thank you.
Amy?
Hi, I'm Amy Crow-Sunleaf. I'm a licensed mental health counselor in the state of Iowa. I've been on the board since April of 2021, so not quite a year. Marcia, I remember seeing you and your husband and sons walking your dogs along Grandview Avenue. I used to live on Grandview, so.
You look a little familiar.
Yeah, so I remember seeing you. Jess, I don't remember ever seeing you before, but welcome to the board. And I think your background is going to, of both of you, is going to serve us very well as we look for a new executive director and figure out just how we want to structure the Department of Public Health in Dubuque County.
Hendrik?
Yeah, welcome, Marcia and Jessica. Marcia, I know you. We worked together for many years. I'm originally from Germany. I'm an internist and infectious disease specialist by background, and I joined the Board of Health in 2021 because I wanted also to give back to the community that became the new home for me and my family. I'm excited to have you both joining the team because you bring very good perspective to the field that we need to address here. And I'm really feel lucky, like everybody else here, that you made that step to join us here. So thank you very much.
Thank you. Sandra?
Yes, thank you, Tom. I'm Sandra Larson, and I've been on the board since June of 2021. I'm a retired attorney, and prior to having a private law practice, I was a registered nurse. I grew up in northeastern Iowa and then spent most of my adult life in Michigan. And when it came time to retire, I returned back to Iowa because I have family here, but also because of the beauty right here in Northeast Iowa. It's just unsurpassed. And I'm happy to be here, and I'm happy to be contributing to the Board of Health. And I welcome the new members. And I just want to say, I think the makeup of the board right now is quite exciting. We have so many different backgrounds that I think are going to bring so much to the board. And I think we could really have a good and transformative year. So welcome, all of you.
Thank you. I don't see Adam, but I do see a iPhone here. If that might be Adam. Adam, are you on the call yet? Okay, he wasn't sure whether or not he was going to have good internet, so I think we'll, if he does join, we'll let him introduce himself, but let's keep on moving. So, welcome everybody. Uh, The next item is the approval of the agenda. And I know that Dr. Hendrik Schultz can only be with us until 7 o'clock. And Samantha, could you share the agenda?
Yep, one sec.
Okay, so we are at number 4, approval of the agenda. Hendrik has requested that we switch number 8 and number 6, the election of officers for the coming year. Not knowing how much discussion that's going to take, I know he'd like to be a part of it, and I would like him to be a part of it. So if it's okay, I would like to move the reports to in place of number 8, and then move election of officers to right after the approval of the minutes. Is there any concern with that?
No.
No,
Okay, could we have a motion to approve the agenda as amended?
Only
Motion to
if I move to move 8 to 6 and 6 to 8.
This is Jess. I would second.
Okay, so I didn't catch who made the motion.
Amy,
Amy, okay, Amy moved and Jess Smith seconded. Samantha, could you take care of the vote?
Amy,
yes, I.
Marcia,
aye.
Jess,
Aye.
Sandra,
Aye.
Hendrik,
I,
and Tom.
Aye.
6 aye, motion carried.
Okay. The next item is the approval of the 15th of December meeting minutes, and they were included in the packet. I would expect that we will need to have the 4 of us that were on the meeting or on the board at that time approve those minutes. I wouldn't see how Jess or Marcia could participate in that.
I move that we accept the minutes as presented.
Thank
This
you,
is-
Sandra.
this is Henrik. I seconded.
Thank you, Hendrik. Moved and seconded to accept the minutes as presented. Sandra, or Samantha?
Amy,
Aye.
Sandra,
Aye.
Hendrik,
I,
Tom.
Aye.
Okay. And then I'll mark Marcia and Jess as abstain, if that's okay with you,
Okay.
and motion carried.
So that would bring us to the election of officers. And I would like to refer to the bylaws so we're sure that we're doing this correctly. We elect officers at the first meeting of the calendar year. We elect a chairperson, a vice chairperson, and a secretary. The secretary has normally been a member of the health department staff, so that we will not elect a secretary. The election is for a 1-year term, and the term takes effect at the close of the meeting where the elections take place. So, and the rest is the duties of the chair and the vice chair. So at this time, unless there are any questions, I would open the floor to nominations for chair.
this is Henrik. I would make the nomination for Sandra Larson to become our chair of the Board of Health. I think Sandra has great qualifications living in 2 worlds, the world of nursing and the world of law, which brings a unique perspective to what we need for somebody to lead us as a chairperson in this board.
We have a motion. Do we have a second to the nomination of Sandra Larson?
I would second that. This is Amy Sunleaf.
Okay. All right, so we have a motion and a second for Sandra to take over as the chair of the Board of Health. Is there any discussion? Samantha, would you please take the roll or take the vote?
Amy,
Aye.
Marcia,
Aye.
Jess,
Aye.
Sandra,
Aye.
Hendrik,
Aye.
and Tom.
Aye.
6 motion carried.
Okay. All right. With that, I would open the floor to nominations for the position of vice chair.
I nominate Adam Hoffman.
Okay.
I second that.
I guess Adam is not here to, and I guess we didn't ask Sandra if she would accept the nomination, but in Adam's absence, I think it's maybe a bit presumptuous of us unless someone has talked to Adam.
I have, Tom.
You have?
I talked to him late this afternoon and asked him if he were nominated, would he accept it? And he said he would.
Okay. In that case, I don't feel that he's being penalized for his absence tonight. So, okay. So we have a motion and a second for Adam Hoffman to serve as the vice chair for 2022. Discussion? Okay. Hearing none. Samantha, would you take the vote?
Amy,
Aye.
Marcia,
Aye.
Jess,
Aye.
Sandra,
Aye.
Hendrik,
Aye.
and Tom.
Aye.
6 motion carried.
Okay. All right. So as the bylaws say that as of the close of this meeting, these two will assume their roles as the chair and vice chair. So congratulations, Sandra and Adam.
Thank you, Tom. And just a moment, I want to thank Tom for his years of service as chairperson. And for the few months that I've been on the board, I've been able to watch him and see how he's functioned and led this board during extremely difficult times. And so I just want to say that I, as a member of the board, really appreciate your service, Tom. Thank you very much.
Well, thank you. Okay. All right. So with that, I would turn to Samantha for the COVID-19 update. And I didn't like what I saw in the news release or the news late this afternoon, so let's go ahead and discuss it.
Mhm. Are you able to see my screen here?
Okay.
Okay. So this slide is mostly for our new members to the Board of Health, but this is what makes up our incident management team. Stacy Killian from the Visiting Nurse Association, Tom Berger from Emergency Management, Mary Rose Corgan from City Health Services, and me, Samantha, in the interim for Dubuque County Health. And along with some ancillary staff from all 4 of these agencies and departments, we make up the incident management team. So this slide shows our community transmission level in the United States right now as of this morning. Dubuque County is at a high level of community transmission, which has been this way for a few months now. And as of this morning, 99.4% of all US counties were labeled high community transmission as well. Our 7-day percent positivity is 32.55%. This slide is showing a comparison of Dubuque County totals over the past month. So back when we met last on December 20th until today. And as you can see, our active cases have increased significantly since then. They're now at 3,136. And just a refresher, how we get the active case count is by taking our total cases minus our total recoveries minus our total deaths. And that high number of 3,136 aligns with this chart here, which is our positive COVID-19 case trend line in Dubuque County over time. This is from March 1st of 2020 until today. And as you can see, we are at our second highest peak, our first being back in November of 2021. This peak, the rise to this peak has been gradual, and it is difficult to predict when it will begin to go down. This is some information on our hospital data. This information is reported to the incident management team and the media on a weekly basis. It's also reported to the Iowa Department of Public Health on a daily basis to include on a public dashboard, which you can see. I pulled this screenshot from that public dashboard, and I included the link to it as well if anyone's interested in looking at that data. But as you can see, the trend lines here on these graphs are similar to the one I just showed earlier on the previous slide. And as of today, we've had 49 hospitalizations related to COVID-19. And of those hospitalizations, 63% were unvaccinated. We know that vaccinations prevent hospitalizations. We also know that while there are some who are hospitalized with COVID who are vaccinated and boosted, our hospital staff are reporting to us that those individuals are seeing shorter stays in the hospital compared to those who are unvaccinated. This pie chart shows our positive COVID cases by age in Dubuque County over the last 7 days. And on our IDPH DOMO website today, it was reporting 900 positives since January 12th. And of those 900 positives, 61% of them were made up by those 39 and younger. And that trend we've seen for probably the last month. That's not new to us. It's the younger adults who are making up the majority of our positive cases. This slide also shares that in the last 7 days, 2,976 COVID tests have been completed in the county. And like I said earlier, 900 of those tests came back positive. This slide shows our variance by month in Dubuque County. And as you can see on the far right side is January of 2022. IDPH is currently reporting that 90% of all positive COVID cases in Dubuque County this month so far have been Omicron, and the other 10% have been Delta. This estimation comes from sequencing a certain number of COVID positive cases that are making its way to the state hygienic lab throughout the month. So like I said, it is an estimation, but it is giving us a good idea of what is going on in Dubuque County right now. This is the same slide, but for Iowa as a whole. And this is estimating that for January of 2022, so far, 78.2% of all positive COVID cases, that should say in Iowa, have been Omicron, and the remaining 21.8% have been Delta. And this is done the same way through sequencing with the state hygienic lab. So it's similar to what Dubuque County is seeing, though Dubuque County is reporting higher percentages of Omicron. This slide shows our Dubuque County vaccination and booster data by age, and there's a lot of information on here. It's all good stuff, but some highlights are that 59,507 individuals are considered fully vaccinated as of today. And what we mean by fully vaccinated is anyone who has received 2 doses of Pfizer or Moderna or 1 dose of the J&J vaccine. Another highlight from this slide is that 32,025 individuals have received a booster as of today as well. And what we would deem that is up to date. So someone who's up to date means that they're fully vaccinated and they've also gotten their booster when they've become eligible. So these percents on the side give a good idea of who is up to date in that age group, but it is important to note that not everyone who has completed their vaccination series or is considered fully vaccinated is eligible for a COVID booster at this time. The CDC recommends that you become eligible to get your booster dose 6 months after receiving a Pfizer or Moderna vaccine and 2 months after receiving a J&J vaccine. So in these percentages, there are some individuals included who aren't eligible yet, but like I said, it's still giving us a good idea of who is up to date in those age groups. This is just some information on our vaccination clinics in Dubuque County. COVID vaccines continue to be available at clinics and doctors' offices, as well as some retail pharmacies. And I included the link here to the county website that details where you can get a COVID vaccine, along with location, addresses, and their hours of operation. And the Visiting Nurse Association continues to have walk-in clinics on Mondays and Fridays. They have one this Friday from 8 to 4:30. And our Sleeves Up line is still running, and that takes calls from the community with individuals needing assistance with scheduling a vaccination appointment, navigating the websites to find a location closest to them, or facilitating a ride to the appointments through the RTA. This slide includes some testing information in Dubuque County. Though the need for COVID testing remains high and Dubuque testing supplies, specifically rapid tests, remain limited, the most important thing is that quarantine is still a necessary step while individuals are waiting their test results, regardless of what kind of test they received. This is the best way to prevent further spread of COVID-19. Our rapid test kit supplies are limited for our healthcare providers, and they continue to be on a limited allocation from their suppliers. Over-the-counter rapid tests are available at some retail pharmacies, but those supplies fluctuate on a daily basis and they can be back ordered at times as well. The newly established testing sites that we have in Dubuque County, like those rapid ones out at Kennedy Mall or down on Central, are pop-up sites that were not coordinated by the incident management team and are independent from the efforts of our healthcare providers and our pharmacies. Local public health does not have regulation or authority over those testing sites, but the incident management team has been working as close as we can with them, as well as the Iowa Department of Public Health, to ensure that they're following the state guidelines with reporting their cases, wearing masks, social distancing, that sort of thing. Another point to this slide is that yesterday, the federal at-home rapid test ordering website went live. It's covidtests.gov. I don't know if any of the board members have tried to use it yet, but I did sign up yesterday. It was fairly simple. You just put in your name and address, and it will send you 4 rapid at-home test kits. It did say that it will take 1 to 2 weeks before they're able to ship to me. And another issue that I noticed personally, and then we noticed while talking with the schools today, is that the website is having difficulty registering apartment addresses. So we're hoping that's something that gets worked out, as this system continues, but it is another source for rapid tests throughout the country. The CDC has updated their mask guidance, and I included the link to that here, but also an infographic that they have on their website as well. And it just details pretty easily the types of masks that are available and the effectiveness of those masks. Ultimately, what it's saying is that N95 respirators and KN95s are more effective than disposable masks or the fabric masks that you see in the community, but any mask is better than no mask at all. Also today in the news, the Biden administration announced that they were going to be administering 400 million N95 masks to community health centers and pharmacies throughout the country. This will be starting next week, but be in full effect at the beginning of February. But we have yet to receive information from the Iowa Department of Public Health or the federal government other than that. So there'll be more news to come on those masks in the coming days. The CDC also updated their isolation and quarantine guidance. For those who test positive for COVID-19, regardless of their vaccination status, it's recommended that they stay home for 5 days and monitor their symptoms. If their symptoms are improving or have gone away in those 5 days, they are able to leave isolation, but are recommended to wear a mask around others for an additional 5 days. But if they have a fever or their symptoms have not subsided, they are recommended to extend that isolation period. If you are exposed to someone with COVID-19 and you are vaccinated and up to date on your booster, it's recommended that you wear a mask around others for 10 days and test on day 5 if possible. If you develop COVID symptoms, it is recommended that you get tested and begin isolation until your test result has come back. If you are unvaccinated or not up to date with your booster dose, it's recommended that you stay home for those 5 days and continue to wear a mask around others for an additional 5. And if you are unable to quarantine, it's recommended that you wear a mask for up to 10 days and test on day 5 if possible. And again, continue to monitor your symptoms throughout this process and extend your quarantine or isolation based on those symptoms as well. I included the link to that guidance as well. I know that there's kind of a lot there and it can be confusing to the general public. So the incident management team has met to discuss plans moving forward for our contact tracing efforts to include increased messaging on isolation and quarantine guidance. And that is further down on the agenda and also included in the agenda packet. But that's all for a data update, at least. If anyone has any questions, I can try to answer them, but I can also take any back to the incident management team as well.
Samantha, I have a question about the hospital number.
Yeah.
Are those patients that are being treated only for COVID, or are they people that might be in for an appendectomy and they find out that they're positive?
It's my understanding that there are patients being treated for COVID, but I can check on that.
Okay, thank you.
So the majority is probably COVID. Any kind of elective surgery gets pre-tested, so they would not even get into the hospital. So if it's emergent, then you might have a positive in there. But from what I recall from my practice is that if the main reason for admission is COVID, you're listed under COVID. Otherwise, you're listed under appendectomy, because that's what brings you into the hospital. I would like to make a comment on the data that Samantha presented. I think one of the things you noticed is that we have a very high peak right now that is comparable to what we saw in November of 2020. And this peak, if you look at the data in Iowa, is significantly faster and steeper than it was, but it's also coming down significantly faster and steeper than before. And this is a trend that is actually we observe around the world. Omicron, as you remember, started in South Africa, then was found in the UK, and then hit the United States. And we see the same trend now more significant at the UK. Their numbers are trending down quite a bit. Overall, I think that is a favorable trend. And the reason is the Omicron variant seems to have a less severe course, but might be more infectious. So it can infect a lot of people, vaccinated and unvaccinated, but might not cause as much damage as the original strain or the Delta strain. And the exposure to it and the infection with it, whether vaccinated or not, will probably also close some of the gaps in the herd immunity that we need to leave this all past us. And the other thing I wanted to comment on is if you look at the hospitalization data compared to November of 2020, when we really had a crisis here, the numbers are significantly lower than that, which is an indicator that vaccine and the increasing herd immunity also mitigates how bad the disease can hit you. So I think we're on the right path. Not that anybody wanted to hear more about COVID or Omicron. I think we all have enough of that. But I think what we see on the data side is moving in the right direction. And I'm cautiously optimistic that this will get better.
I think the other thing that we're seeing with the Omicron is much to your point, that it's definitely more transmissible. More people are getting it, and that's actually having a bigger effect on workforce in general. So, you know, we see restaurants aren't able to be open, and people are not so sick that they have to be in the hospital, but it's affecting kind of day-to-day life. But the trend is going down, so hopefully that, you know, we recover from that pretty soon. But it's definitely a more marked effect on society as a whole with this Omicron, as opposed to, you know, 15 months ago with, you know, the first surge.
And I think, oh, sorry, go ahead.
Go ahead. Go ahead.
No, I think Jess, you're making a very important point. The staffing issue is still something everybody has to be cognizant of, that if you get sick, in the hospital. You don't have the staffing situation you had in 2020. You have less than that, and that's nationwide. So we have to be cautious to make sure that we don't do something that would increase the number beyond what we can handle.
I just want to speak from the school's perspective.
Excuse me, Mark, this is not public comment. This is, the time for public comment was earlier.
All right, excuse me.
Thank you. Is there any other board members that have a comment about the update? Okay, then let's move to item number 6. Receive and file the reports from VNA and from the Food Policy Council, quarterly reports. So Samantha, you have those documents. They were included in the packet.
Yeah, do you want me to share them on the screen too?
Unless there's any discussion, I would entertain a motion to receive and file. The board members have had an opportunity to review those.
I'll make a motion to receive and file.
Okay. And this is for the VNA and the Food Policy Council. Do we have a second?
A
This is
second.
Jeff. Okay.
Okay, thank you, Marcia. Is there any discussion? Okay, Samantha, would you take the vote? And I have heard from Adam that he's not able to get in, so.
Did he try getting in, or do you mean he's not able to join? I could resend him the
He's
link.
not able to get into the meeting.
Huh, okay. I'll resend it to him. Amy,
Aye.
Marcia,
Aye.
Jess,
Aye.
Sandra,
Aye.
Hendrik,
Aye.
and Tom.
Aye. I don't-
6 aye, motion carried.
I don't think you need to send him anything, Sam. He's just said he's having difficulty getting a connection.
Oh, okay, I understand. Sounds good.
Okay, so that motion has carried. We are then on to item number 9, our response to public comment. And this was Sandra, you had asked that this be added to our agenda a couple weeks ago or a couple months ago. So I
Yes.
guess I would open it to discussion.
Okay, just a couple of comments. I've noticed in some of the meetings, we do have public questions. People ask questions. And during public comment, we can't answer them and we can't respond to them. So, and during our meeting, we don't. So I'm wondering if we should do something, respond to them somehow after the meeting. I know if it was myself, if I was asking a question and everybody just ignored it, I wouldn't like that response. So I'm just wondering if Samantha might have some ideas about how that could be handled or should be handled.
Yeah, I was thinking about it and I agree with what you're saying, Sandra. I was wondering if we could just have it on the agenda as a standing item. You know, this is our time to respond to any comments or questions we got at the previous meeting. And then me or whoever is the secretary would record those questions. And you would either have that person be the person responsible for collecting the answers or divide that up among board members. And we could have them in written response form to provide to the next meeting. That was my thought, but I'm sure there's other ways to do it too.
Mm-hmm. I think it probably depends on what the question is and how complicated it is. But if it was a pretty straightforward question with a straightforward answer, could an email, I actually would suggest not an email. I would suggest maybe a written response sent in the mail to the person. What I'm trying to avoid is so that there's not like an argument happens over the email or something. So those were just some of my ideas, either write a written response to them after the meeting, or I like your idea, Samantha, that the next meeting we would certainly also answer the question. But I think waiting for the whole month for the meeting might be a little bit long. So what do the other board members think?
This is Hendrik. So one of the things that I've experienced that is a consideration is you could also use the chat function, for example, to have, when we have a question time as part of the board agenda, where questions can be posted and then they can be brought up out to the board members and they can choose to answer. That would be one possibility. That would be a little bit more real time than just 1 month.
This is Jess. I don't know that I have an answer, but I support your notion that when people have comments and questions for the board, that we owe some sort of response. And I do like the written comment as opposed to, an email that could be a banter back and forth. I like the idea of something more concrete and official, I guess.
This is Tom. I guess my concern is that if this is something that the board has to make a decision on, we really are limited. It's brought up, we can't deliberate it during that meeting. We have to deliberate it in public, in a public forum. So that does tie us to the next meeting. If, however, this is something that can be answered by the staff, or it doesn't require a decision or a determination on the part of the board, then I think it can be answered, over the course of the next few days. But if it's something that the board is going to have to make a ruling on, then we're tied into addressing it at the next meeting or at a special meeting if it's something that urgent.
Yeah, I totally agree with you on that, Tom. So I guess I'm just thinking of a straightforward question. I think someone a few months ago had a question about what the Board of Health's recommendations were about mask wearing indoors. Well, that's pretty straightforward because we can just refer them to our recommendations or remind them of our recommendations. So that type of thing is what I'd like to have. I mean, I think we could answer almost immediately after the meeting in writing. But anything else that would need deliberation, I agree, would need to be held over till the next meeting.
Okay.
Anybody else have any comment?
I know in the past for certain public hearings and things, we've used an email account to allow people to email in questions or thoughts ahead of the meeting. So that could also be an option, possibly too.
Right. Good idea.
Okay. Again, that would require that it be on the agenda if we're going to address it at that meeting. So there's a question of timing that comes into play.
Right.
And along with the timing concern too, it would be if this was to fall back on health department staff, do we have the time to spend with the questions? Being a 2.5 person department, there might not be time for all the questions depending on what they are.
True.
Is it against the bylaws to add in a response at the end of the meeting to answer those questions?
I don't believe it's against the bylaws. It just, we don't have the ability as a board to deliberate something if it's not on the agenda. If it's something that requires us as a board to make a decision or take an action, we can't do that without going through the public meeting process.
So Tom, this is a logistics question. Since the public comment period occurs before the approval of the agenda, could you make an addition to the agenda for the meeting prior to it being approved?
The public comment as we have it now, Jess, applies at the beginning, applies only to items on the agenda.
Gotcha.
There's a second public comment at the close of the meeting where items not on the agenda can be addressed. And I think that's specifically so we're not, throwing things on the agenda right ahead of the meeting being called, or right after the meeting being called to order.
Well, I think I would just recommend that we at least, to begin with, put it on the agenda. If it's a straightforward question, we would have it on the next month's agenda just to answer, respond. And then if it is something we want to deliberate, then we would put it on the agenda, ahead of time. But I'm just thinking about the real straightforward information seeking questions. So.
Yeah, and I guess I don't see anything that violates open meetings laws or regulations for us to give an answer if it's a straightforward question. What is your policy on wearing masks indoors?
Right.
As we stated on August 12th, here's our policy.
Right. So we couldn't, I don't think we could answer at that very meeting, but we could we could have an agenda item each month. Answers to questions or something like that, just something very simple, just so that we are responding in some way. And then I think when we get our staff in the Department of Health back to the regular level, then maybe we can think about doing written responses.
The other thing I like about that, Sandra, is that though the written responses would be great, I think that there's other people involved in the public meetings that might be interested to know the answer as well. So including that answer somewhere for everyone to access it would be a good idea too.
That's a good point.
I'm speaking out of turn, but mine was merely a comment, not a question.
Tom, do we have to do anything formal with this? It seems like we can just it's kind of a policy, but I don't think we have to have a motion or anything, do we?
No, I don't think so. I don't see this as an actionable issue at this point. I think if we want to try something, we can. I don't think we have to set a policy.
Okay.
Okay, anything else on that topic? Okay, hearing nothing. Next topic is strategic planning and director replacement. There were several of us that took action items away from the last meeting to gather some information. So I don't think there's any recommendation coming forward from that, but just a discussion of what we've found. I know Adam was going to be talking with Lynn County, I believe it was, or Scott County, excuse me. But Adam's not with us tonight, so. I did reach out to Blackhawk County, and what I found in Blackhawk County is they do have a strategic plan. It's an 11-page document. It looks and feels an awful lot like the community health needs assessment and health improvement plan. Basically, they worked with a group through the University of Northern Iowa and spent from April of last year until October of last year developing a strategic plan. I'm not sure that we have the time we have the luxury of that amount of time to develop a strategic plan. I think we need to be cognizant of the fact that our health department is understaffed and we need to keep this moving. So, Sandra, what did?
I got to speak with the director in Johnson County, and her name, let's see here, is Mrs. Majewski. She was hired by Johnson County last August. And so the hiring procedure was very fresh in her mind. And so I'll share some of that with you in a minute. She was previously the director in Washington County, which was a small county. And so now she's in a much different situation. Johnson County has 50 employees, I believe. And they have a lot more at this point, to work with than we do. One thing they're doing is they're asking their board of supervisors to approve a new position in their department that would be specifically to communicate with the public and specifically communicate with underserved areas, basically. So I thought that was kind of a good idea. But the hiring process was a 4-stage process, and it involved, of course, the human relations department and the Board of Health, but they also, for one of the interviews, they brought in community partners that they work with, including the state hygienic lab, somebody from there, somebody from the clinics that they sponsor or run. So lots of people from their partnership came in on it for a panel interview. Then they had a third interview, which was mostly with the Board of Health and the HR department. And then the fourth step was each candidate gave a presentation to their staff, and they have 50 staff, but gave a presentation, and that was filmed so that the Board of Health members could later watch it. But I thought that was kind of a good idea also, because I think it's going to be important to see how the candidates are able to present to the public. So anyway, I think our HR department, our county HR department, will be very helpful to us and help us get this going. But I agree, Tom, we do need to move it along. This is another thought. We probably need a strategic plan, but maybe we kind of need to hold off on that until we have the new director appointed, because that person will need to basically own that strategic plan and work off of it. So they maybe should be involved in developing it. And Tom pointed out to me that in our mission statement, it reads very similar to a strategic plan. And so, I mean, temporarily, at least we could kind of follow that. I think another thing, we're still talking about changing the Department of Health. So we just have a lot of balls in the air right now. So we're not sure how any of that's gonna land, but or at least Johnson County, I liked their hiring procedure. It sounded like it was very thorough and really obtained a good candidate that way.
I didn't mention, Sandra, that Blackhawk County has upwards of 45 people on their staff. There are 4 managers reporting to the health director in Blackhawk County, so.
Yeah.
Yeah, we're not talking apples and apples, that's for sure.
No.
I talked to the Lynn County Executive Director, and they have 58 employees. And they have invited us to their new facility for a tour. He said he would love to do that. And then he said it would be a great day trip for us also then to go to the regional center and help me with what that's called.
The Access Center.
Access
which is
Center. He
Mental
said we
health
could,
and substance abuse.
yep, he said we could very easily do both of those in one day, and he could help us set all that up. But he suggested that we take a close look at the 1988 focus on 3 core functions of public health. Jess and Sam, you probably know this from your studies. And then also the 2014, I think, 10 essential services of public health, and to use those as a guidance for how we develop. He was really excited for us. He said that this could be a really groundbreaking opportunity for us to make a real change and real difference in Dubuque County's public health. So he was really excited and very willing to talk to me again if we need to. And like I said, he really wanted us to come down there and tour their facility, which sounds phenomenal. They don't necessarily contract out for the services like Dubuque County does, which is why they have so many employees, I think. But Lynn County is a leader in public health. They've won all sorts of awards nationally and statewide for their public health. So I think we're going to probably want to really look at what they're doing pretty closely.
Great, great.
Thank you.
So where do we go from here? We've gathered a bunch of information. We're at one end of the spectrum versus the other end of the spectrum with the 3 counties we've got information on, us contracting it out and then doing it themselves. What's our next step?
Well, Tom, I think you've probably already, met with HR, right?
I did, yes. When I got with Dawn and we took the job description that exists today, and basically what we had done was put that in a requisition to replace the health director with the job description that exists today. So, I mean, that would have given us the ability to move forward with, hiring a director on a parallel path to doing the strategic planning. And I guess it was my feeling at the onset, Sandra, that, it would be a disservice to a new director to develop a strategic plan and then say, here it is.
Right.
So Dawn is tied in. I have looked at the job descriptions for all 5 counties, Dubuque, Johnson, Blackhawk, Lynn, and Scott County, and they look very similar. They're all worded a lot in a much different way, but they look pretty similar.
I've only seen the one from Dubuque County.
Well, I pulled all 5 of them from the websites. The county
Okay.
websites. I can send them to you.
Oh, thanks. So I mean, what does the rest of the board want to do? I mean, are we ready to just to meet with Dawn and tell her to go ahead and post the job? I mean, it might be changing a little bit because we did put in for for more staff, right, with the funds, and that's going before the Board of Supervisors. So
Sandra, I would interject at this point that goes to the Board of Supervisors next Wednesday at 1 o'clock.
yeah, so we might know pretty quickly if any of our funding requests are going to be going forward. So, but I do think that we need to move. And is it a consensus of the board that this current job description is what we want to stay with? I mean, that's kind of the question, right?
Yeah, I see that as pretty much the question. And, in my humble opinion, I didn't see a lot of variation from one job description to another. The structures of the department are vastly different, but the job function of the director is still the same. So it can't hurt us to meet with HR.
Right.
And have Dawn at least take a look at the other job descriptions to see if she shares my opinion.
Oh, that's a good idea. And who would like to meet with her? And I mean, we could have a couple of people meet with her, I think, and we can't have too many because then it's a quorum and it has to be a public meeting. And I don't think we want to start out with that just yet. So,
Yeah.
So I would certainly like to meet with her and have someone else from the board come with me.
I would certainly be willing to do that since I've already initiated conversations with Dawn about it.
Okay. Does anybody else want to come along?
This is Jess. I'm happy to join as well.
Okay. And Tom, 3 people would be,
Yeah, 3 people is not a quorum. If we get to 4, it needs to be a public meeting.
Okay. And I think there are some ways when you're hiring, we'll have to talk to Dawn about it, but there's some ways to avoid the public meeting thing too, but she knows all those details. She can fill us in with that.
Yeah.
Okay. I think that's a good way forward, that we'll get it started this next week, hopefully, and meet with HR and kind of go from there.
Okay. Do you want me to try and set that up, or do you want to set it up, Sandra?
Why don't I set it up and then we'll coordinate the time with you.
Okay, that sounds fine.
And Jess too.
Sounds good.
Okay. So, anything else on that issue? Okay. The next item has to do with the interim director and how Sam is able to maintain or be that point of contact for Iowa Department of Public Health. So, Sam, I'll turn it over to you.
Sure, yeah. So what I've learned over the last few days is that the 24/7 contact line that we have with the Iowa Department of Public Health, because of our unique situation where we subcontract with the VNA, it's more of like a collaboration between the health department director and the VNA director, and a phone tree system where IDPH will contact us after hours. And I believe they've got 3 contacts listed between us and the VNA. So after Patrice retired, who was our 24-hour contact, we do not have one as of right now. And we do not have a phone plan set up for the interim director or the next director to become that 24/7 contact and join back in with that phone tree between the VNA, the health department, and the Iowa Department of Public Health. So I asked if this could be on the agenda to have a conversation about purchasing a phone like that, and as well as getting a plan organized again with the county.
Okay. And to my knowledge, I believe there is money in the budget for this. Is that correct, Sam?
Yeah, I think that we would be fine to cover the cost of a phone. And then there is a service area grant that would cover the monthly phone bill under emergency preparedness.
Okay.
What, why do we need a new phone? I mean,
We do not have any phones at the health department right now to use. I guess. Yeah, cell phones.
cell phone.
This is a 24/7 phone that would be taken home with the interim director or the director to be that 24/7 contact that the Iowa Department of Public Health can call in emergency situations. One example would be like when we had our first COVID case in Dubuque County.
But what happened to the old phone?
I believe it was turned in when Patrice ended our phone plan.
I can tell you what happened. Patrice had the phone. It was her own phone. The county owned the plan that supported that contract, but Patrice owned the phone. And she kept that phone as her personal phone when she left. So the department did not physically have the phone that Patrice used for her 24/7 contact with Iowa Department of Public Health. So we're basically starting from scratch here. To me, I think it's something that we need to do. You know, and
Yeah. It sounds like it, yeah. And what about the contract? I mean, so Patrice used her own personal phone, but there was some sort of contract that set up this 24/7 contact, or?
The 24/7 contact piece of it, I believe, is just a list of contacts that we send to the Iowa Department of Public Health. And it's Stacy Killian, the director of the VNA, their communicable disease nurse, and then the director of Dubuque County Health.
Okay, so the Department of Health just needs a cell phone that can be dedicated, and someone, designated person, carries it with them 24/7.
Right. Mhm.
that is correct. It's the difference between the hardware and the plan. Yeah, the county had the plan, but Patrice had the phone that the plan was used on.
So do we just need a motion to approve a phone and a plan?
Yes.
This is Jess. I would so move.
Okay. And it's my understanding that the department would pay for the phone, and Iowa Department of not Iowa Department of Public Health, but the contract would be paid for under a grant. So we have a motion
I second it.
and a second. Any further discussion? Samantha, please take the vote.
Amy,
Aye.
Marcia,
Aye.
Jess,
Aye.
Sandra,
Aye.
and Tom.
Aye.
5-1 motion carried.
And Hendrick had to leave, so we're down to 5 members right now, so. Okay. So we have a couple of recommendations from the incident management team, and there are documents. Are there documents in there for this?
Yeah.
There are. Yep.
Okay. So the first is on contact tracing. So I believe that, are you going to do this, Sam, or is Stacy Killian going to, or?
I can start. And Stacy, are you on the call right now?
Sam, I am on, Sam.
Okay. So Stacy at the VNA their staff are currently the ones conducting the contact tracing in Dubuque County. So any contact tracing questions, I would probably want to direct to Stacy. But the plan that was included in the agenda packet and that was laid out and detailed for you all was put together by the incident management team. And it came, following the surge and the change in testing and things like that. The reasons why are also listed in that document. And it's not necessarily a request for funding to do these activities. The funding was already approved by the Board of Health for contact tracing through the VNA. This is just a shift in what we currently do and changing that to a new process that the incident management team feels confident in based on how contact tracing has gone for us so far in the past few months and where we are right now in this Omicron surge. But if there's any questions, I can answer them, and Stacy is on too.
This is Jess. I support the change in funding. I think with the increase in at-home testing, contact tracing is, not nearly as beneficial or helpful as it used to be, mainly because we have a lot of positives out there that are never kind of reported to any regulatory board or the state hygienic lab. The one thing I did want to see is if in the funding or the hotline for the quarantine isolation questions and support, if we could, if the public would also be able to ask questions regarding testing. I think there's tons of questions in the community about where to test, how do I get a test? And it feels like no matter how many times we tell people, or refer them to the website, it feels like there's always a need for people to have help navigating kind of the testing situation right now. So that would be my only comment.
Stacy, do you want to touch on that, or do you want me to at all?
Yes, I can actually touch on that, Sam. And I think I agree. I think we definitely need to include that when giving any guidance with anyone. And typically through our public health call center, we've tried to do that. Any questions that have come in, we tried to direct them where to go for testing, where to go for isolation, quarantine guidance. We give that to them. We also provide them vaccine information. And so that would always be included in anything we would do.
This is a different phone line though, or is this just funding the phone line that is already happening?
So this would be the VNA phone number. Oh, go ahead, Stacy.
Sorry, Sam. Yeah, this would be the VNA's phone number, and we will be switching our automated system. So this comes up right away with questions. Please hit 1 and it'll direct it right to one of our staff that can answer those questions. We've got it kind of divided out now between vaccines, general questions, and then we'll be adding for isolation and quarantine. So it would not be setting up an additional phone line. It would just be calling the VNA.
Well, I guess my question is, why do we need extra funding for that then?
This isn't necessarily extra funding. This funding was already approved by the Board of Health for contact tracing in the past, and it was used to fund the staff member at the VNA who was doing the contact tracing calls. So now this funding, as you can see in the table at the bottom of the proposal, the funding would still go to funding that staff member who's answering those hotline calls, but then additionally, extra funding that within that already allocated amount would be used for the increased marketing and social media materials.
Right, I know it's not new funding, but it's new funding for the phone line, but it's still the same phone line, right?
Correct, yeah. In the original plan proposed by the VNA, the funding was going to be used for that staff member. And so it's still the same in that way. The only change with that funding is that some of it has been taken now to print materials and develop social media materials to share information on isolation and quarantine guidelines.
I think Sandra's question, and correct me if I'm wrong, Sandra, it sounds like right now, without any changes, there's already somebody answering a phone line to answer questions, and there's someone doing contact tracing calls. Is that correct?
Right now, they're the same person. Correct, Stacy?
That is correct. So right now we have one dedicated staff member who's been working actually 7 days a week doing contact tracing, where we make sure that we have somebody there to make those calls. In this case, what it would be doing is switching her roles to make sure that she's completely dedicated to COVID. And so she would be there to answer the calls rather than when you're calling into the office, if you're asking for a nurse or something along those lines, they may have other duties or activities that they may be assigned to. This will keep that person full-time to COVID. So there's always somebody there answering these questions, if that makes sense.
Yeah, I don't think we're adding any additional phone activity. We're changing the focus rather than trying to reach out and contact people who have been identified as having been in close contact. We are now dedicating that person or that time to answering questions that are coming in to the VNA regarding isolation, vaccination, testing, and we're doing the marketing part of it. I think it's a good shift of focus since we've been seeing our contact tracing efforts dwindle, the results dwindle. You know, the percentage of unanswered calls and no callbacks has been increasing over the past 3 months.
Yeah, I don't disagree with that the funds should be shifted. I was just trying to figure out, what we were buying with it. What new thing we were buying with the 23,000. So we're just paying for what we already have is what I hear you saying.
Instead of spending our time making phone calls that go unanswered, we're going to shift our focus to education and marketing.
But Tom, that's already happening as I understand it. We already have a COVID phone line, right?
But we're not doing the publications, we're not doing that other part, and we're increasing the amount of time that's available to those COVID questions. Okay, where are we at on this discussion? Do we have a motion? No, we had a motion on the phone. Okay, all right. So I guess the recommendation from the incident management team is to shift the focus from contact tracing to COVID education.
I have to say that it makes sense to me. I think that contact tracing has not been as successful as we've hoped, and we certainly need to continue our education and public awareness.
I'll make the motion that we shift the funding to, or the focus to the education from the contact tracing.
Okay, all right, we have a motion by Amy to shift the focus to education. I think it's fair to say that we're not shifting any funding. That money is already dedicated. Okay, do we have a second?
I'll second.
Okay, Marcia has seconded. Any other discussion? Samantha, please take the vote.
Amy,
Aye.
Marcia,
Aye.
Jess,
Aye.
Sandra,
Aye.
and Tom.
Aye.
5 motion carried.
Okay, thank you. All right. We are to a point where we have depleted our supplier inventory of masks. And at this point, there is a proposal from the incident management team to purchase an additional inventory. Sam, there is an article or a document in the packet. We have an offer. At this point, the original request was that we purchase another 20,000, and we have an offer from DDI that they would be able to supply 20,000 masks for a total of $2,000. And this is a company we've dealt with before. It's been handled through Tom Berger's office, but I don't know that we have not gone out for a quote on this. This is something we do through our purchases of services. So I guess it's in our hands right now as a Board of Health. Do we wish to provide more masks?
I move that we purchase the masks and develop some plan for distributing them.
Okay. Okay. Do we have a second?
This is Jess. I'll second.
Okay. Discussion. I guess I would ask the question, is 20,000 enough? We had originally contacted DDI, and the feedback we had was that their inventory was dwindling as well. We went back and asked if they'd be able to handle 40,000, and the answer was yes. So I'm just wondering if we shouldn't, given the current situation, 1,003 new cases in the last 7 days, the fact that, we are now out of masks, if we shouldn't increase this to 40,000.
I think we should, as long as we have the money, and that's only $4,000, right? So
That's correct. And make it understood, these are the disposable masks. They're not the N95s or the KN95s, but as was said earlier, any mask is better than no mask.
correct.
So I guess that would require that we amend the motion to purchase 40,000 masks.
I
would move to amend that motion.
All right, so we have a motion, and I believe, Marcia, you seconded, or Jess
I
seconded?
did, but I'll second again.
Okay. All right, so we have a motion to purchase 40,000 masks at 10 cents apiece. And Sam, would you take the vote?
Amy,
Aye.
Marcia,
Aye.
Jess,
Aye.
Sandra,
Aye.
and Tom.
Aye.
5 motion carried.
And I guess I would suggest that we keep an eye on this inventory too, that, hopefully we're going to be getting to a point before too long where we're not going to be burning through them as fast, but I certainly don't want to stand in the way of being able to support this by not having masks available.
Just a question, where do they go and how do they get distributed?
That
Okay,
was my question to the Board of Health as well. I didn't know if if you wanted to make a plan for who would be distributing and where they'd be going. This list here is where they were distributed in the past, and that could be the same or different depending on your opinions too.
okay. Well, personally, I would rather the recommendation came from the incident management team. They're a lot closer to it than we are on the board.
I personally, I don't want to speak on behalf of the incident management team, but I think that the way they were distributed in the past went really well. And the local events, festivals, city halls and mayors, they really took advantage of those masks, and that seemed to be one of the best uses of them. So I would recommend continuing with those as well as local businesses too.
Yeah, I agree, Samantha. I like the list that they went to before, and that looks pretty thorough. But then who takes them? I mean, do you need us to volunteer to take them out to those places, or?
So in the past, Supervisor Ann McDonough and Diane Pape Freiberger did a lot with helping distribute those masks, as well as Tom Berger at EMA and staff in our own office. A lot of ways that they came to us were through referrals or events reaching out to us directly, and then we would coordinate with them, picking them up from Tom's office or dropping them off. But if there are any Board of Health members that are interested in helping with this, that would be greatly appreciated too, because like I was saying before, we are a small department right now.
Put me on the list, Sam. This is Amy.
Thanks, Amy.
You can put me on the list too, Sandra.
Okay.
Same.
I'd help
This
too.
is Jeff.
I'd be happy to help as well.
Thank you, everyone.
Okay. Okay. All right. So that gets us to the septic and wells. So we have two issues. First of all is the Massey Station septic variance that was addressed last month. And it was agreed that we would bring this back to our meeting tonight. And we have since had some recommendations from our counterparts at DNR. And I guess at this point, Sam, would you share the recommendation that we have from Bailey?
Yep. 1 second. Okay, this first part here was included in the agenda packet last month as well.
Yes, and
This is the letter from Bailey.
okay. So can you walk us through it, Samantha?
Sure. I was less involved than Bailey was in this, but it's my understanding that she met with Corey Frank from the Iowa DNR and Anthony from the County Roads Department to look at the right-of-way situation, as well as just the general layout for the plan that they have proposed. It was also recommended at the last Board of Health meeting that the water be tested there, and it was tested. It came back positive for coliform, but absent for E. coli. So last that Bailey spoke with Ken Beesing from Beesing and Associates, he was interested in solving the issues with the well and making sure that that's not a chronic issue before moving forward with a variance request. Because if there were chronic issues with the well and that had to be removed and a new well was put in place, that could alter the plan a little bit. But Bailey included that information in her letter along with the recommendations from Corey Frank and Anthony. And I believe ultimately Bailey's recommendation was to follow the guidance of Corey Frank from the Iowa DNR.
Okay, and Corey's guidance was that that the ability to approve a variance was up to the county board of health, but his recommendation was that it not be approved if there was any encroachment on the right of way.
Yeah, that was part of it. And there is a letter included in the agenda packet where Ken Beasing verifies it is not in a right of way.
Okay.
Otherwise, I think what the other piece Corey is mentioning is that, you know, if there's any part of the plan that is creating an issue or not addressing an issue that's already there with the property, then he recommends the Board of Health not approve as well.
Yeah, I think the man from DNR said that there needs to be adequate protection or something.
Equal protection. It's right in
Right.
front.
Right, of the well. And according to the letter from Mr. Frank, I don't think he was satisfied that that adequate protection had been put in there. And I had some discussion with Adam, and I'm sorry you can't be here tonight, but he said in a letter to me that he didn't think that that issue of adequate and equal protection had been addressed. And then I'm in receipt of an email from Bailey this afternoon, and she says, I would recommend that they meet all the required minimum setbacks. And I don't believe that's what they've asked for a waiver from those minimum setbacks, haven't they?
Correct, yeah. Yep.
Yeah.
And Bailey is at a septic and well training today. That's why she's not here. Sorry about that.
Right, no, that's fine. But I mean, I think Adam, with his water background, was really attuned to this. And I know that he expressed concerns to Bailey, and then Bailey wrote back that she thinks that all the required minimum setback should be followed. So to me, that seems like she's recommending that we turn this down.
Excuse me. Sorry, I missed the first. This is Justin Andrews. I'm one of the owners of the property that is being discussed at the moment. May I?
Since you are
chime
the
in?
I will invite you to make a brief comment.
Okay, thanks. Yeah, so Bailey's been in touch with me, and I'm aware of the coliform found in the well, and so as of Ken's finding that the property is not in the right of way, am I correct in saying that the main issue at hand is the variance we're asking for the drain field being too close to the wellhead? And obviously, as it's contaminated at the moment, if we are able to treat the well and can turn out a forthcoming clean sample, would that have any bearing upon your decision as the board?
Your plan is to locate the septic in essentially the same spot as it is today, right?
As Ken has proposed, it would be beside the house against the retaining wall. Currently, the septic is not in that location. And furthermore, the previous owners who had the septic installed in 2016, the installer has gone through many lawsuits because he did not pull permits for a lot of properties and did not do it according to code. And actually, it wasn't even functioning. And then that's why there was complaints from the neighbor of the effluent to the surface discharge, being discharged to the surface. And, my thought is that perhaps in combination with the property not being inhabited lately, plus the faulty previous system has led to the contaminated well. But I guess obviously Ken's system, his experience in the industry, and in the future, obviously we're going to use, should we get approval, and obviously the main issue is the variance for the well, and or resolving that issue of the distance has to be met, versus turning out a clean sample for the well as is and getting a variance granted. So that's kind of the two options are those two. So, but using a proper, certified pull permit, all the installer, the excavator is above board and doing things according to Ken's design, and they're working together, and we're not trying to hide anything. We're trying to rectify a situation which, was done illegally and unscrupulously, and that basically the homeowner just walked out. He couldn't get any reconciliation done back then, and so we're trying to see what can be done to keep everything first safe. Of course, I want the water to be safe, since we'll be the ones there, and then meeting the environmental guidelines and which can be approved.
Okay.
So, Tom, I think the issue is that Mr. Frank from the DNR did not pass on this, did not approve it. He wants to know, the man from DNR wants to know what, if any, adequate or equal protection would be required by Dubuque County for that minimal amount of separation to that private water supply. And he apparently, I think Bailey shared all of the information with Mr. Frank, but he wasn't satisfied that there was adequate protection there between the system and the well. And I know that, so that's the issue.
I agree with you, Sandra. I don't, I'm very reluctant at this point to approve variance because, one, we've got a well that's contaminated now. We're moving a septic tank closer to the well, and I don't see how all those things line up to provide a water and septic system that can cohabitate and not cause problems.
Right, and I think it might be helpful if the homeowners contractors actually maybe had some contact with Mr. Frank, and they tried to work out something out to assure the DNR that there's adequate protection.
Yeah, I don't know that Mr. Frank gets directly involved with the homeowners.
I don't know either, but that's the area where we have a little disconnect, an issue, and maybe it's not an issue if the DNR knew all of the plans and all of the soil situation out there. Maybe they would say, okay, yeah, that's okay. But at this point, he's not satisfied, from what I can tell.
I certainly don't want to put words in anyone's mouth. I am abreast of the email sent from Corey Frank, and Ken has informed me of that and his conversation with Bailey. And I believe I don't believe he outright rejected it. I think he said, can the adequate and necessary precautions be put in place? So, the words were just, I'm sorry, the words I think he was putting it on the onus on the engineer, the excavator, and of course, coming down to the decision of the board, if I'm not mistaken. And Ken's experience speaks for itself, I think. And I think I did have an hour-long conversation with an excavator that Ken's worked with in the past, has a good reputation. And there was a proposal for a COCO enclosed system, which would be, not a traditional sand filter. So enclosed, meaning that there would be further protection from contamination with the new septic system. And then I think then the issue becomes cleaning, getting a clean water sample. I mean, that's, again, I'm new to all this. And so this is kind of what Ken and I and the excavators have talked about. I think we're wanting to see what can be done. I mean, the technology exists. Ken's confident. He's used it in the past. Excavators have used both sand filters and cocoa filters to, as needed in certain situations. And I understand it's obviously an out of normal proposal being a variance. So, but again, I mean, we want to do what we can. We have the property and have been remodeling it, so
Okay.
to not have a wash.
Thank you, Justin. Okay, I guess at this point I would ask the board is there an action we can take tonight, or it seems like we need to have, do we want to put this off, table it till next month until we can get a little more clarification from Corey Frank and have Adam here to voice his opinion as the expert?
I'd prefer to table it and actually hear from Ken again and hear what his conversation has been with the DNR and to see a clean well test come back too, because we don't want to have that well be contaminated and stay contaminated.
Yeah, and I would assume, Amy, that part of the equal protection would be that we have an ongoing well test. Yeah, I don't know how that protects us, but it tells us when it's too late.
Mm-hmm.
So, do we have a motion to table this?
I would move that we table it and have Ken and Bailey and Justin and maybe another letter again for our next meeting that we can review.
Okay. Do we have a second?
A
second.
motion.
Okay, thank you, March. All in favor? Sam?
Sorry, I was muted. Amy,
Aye.
Marcia,
Aye.
Jess,
Aye.
Sandra,
Aye.
and Tom.
Aye.
5 motion carried.
Okay, the next item, and I believe Dave Schneider is here to address this, but the next item is the, I don't know if it's called Phase 2 of the Country View Estates or just lots 9 through 33, but we have a plat in front of us for 25 lots in just off Hales Mill Road for plat approval. And you have Bailey's recommendation. This is, there were 9 lots or 8 lots that were approved some time ago, and that has already gone through the Board of Supervisors. This second part is bringing the total to 33 lots. And as Bailey says, there will be 6 wells, three of those servicing 6 homes and the other 3 remaining or servicing 5 homes, which brings us in line with the requirements of Iowa State Code Chapter 49. So, Dave, do you have any comments you wish to share with the board before we go further?
Yes, Tom, this is Dave Schneider, Schneider Land Surveying, 906 First Street North, Farley, Iowa, for your record. Yeah, basically, Greg Adams on their Hales Mills Corporation or LLC basically is developing this property. It was zoned residential within the county. And it's within the 2-mile jurisdiction of the city of Dubuque, so it's also being reviewed by them as well, subject to their comments because of that 2-mile jurisdiction, in case they ever would annex into this area and provide city water and sewer. But basically, as a typical Dubuque County subdivision, we've, minimum 1 acre lots is what you're looking at. Most of them are larger than that, to allow for the septic systems, ultimately, which the final design on those will be done as part of each individual lot is developed, and to accommodate the house that's put on there, as well as the soils on each individual lot. The wells themselves are just kind of placed to accommodate the original 2 lots, to accommodate the original 8. Plus one, each well will accommodate an additional lot in the second phase, and then the remainder of the 4 will take care of the remainder of the lots in phase 2. Ultimately, all under one set of covenants, describing how repair maintenance will be allowed for the development itself. And, really here to answer any questions you may have, just looking at, again, trying to stay under that state requirement for a public system, with the understanding that ultimately someday, as Dubuque expands, and again, who knows that number, but that, this thing may someday be replaced with a public system, but ultimately can't really concern ourselves with that because going through that 2-mile jurisdiction process, they have not given us any time frame on that.
Okay.
So we'd be happy to answer any questions you may have.
The other comment I would have, this is Tom, is that, and Dave mentioned this already, that future septic systems would all be subject to permitting and, making sure they comply to the requirements at the time the properties are built. So, any board member have any other question?
I think one of the concerns was that these were going to be large houses, and maybe there would be more people per house than in a typical subdivision or something like that. But I think that as it's proposed, it fits within the state code and everything. And so I don't think we have anyone that could stand out there and keep counting how many people are in each house. So I don't think we could really monitor that. So probably I would move to approve this plat.
Thank you, Sandra. We have a motion to approve. Do we have a second?
This is Jess, I'll second.
Thank you, Jess. Okay, we have a motion and a second. Is there any discussion? Samantha, can you take the vote?
Amy,
Aye.
Marcia,
Aye.
Jess,
Aye.
Sandra,
Aye.
and Tom.
Aye.
5-1 motion carried.
Thank you all.
Thank you, Dave.
Have a good evening.
Okay, the next item on the agenda is the meeting schedule for 2022. I guess it's important that we get the next meeting on the schedule, and maybe Sandra, as the new chair, you'd see things differently, but for now, I'd like to discuss, frequency, time of day, and day of the week. What seems to work best? We have been meeting on a monthly basis.
Well, just from my experience in the past few months, it seems like we have, each meeting lasts quite a while and we have a lot of things to take care of each meeting. And so I would recommend that we continue at least monthly for this next year.
Okay. I would support that, given the fact that, you know, at least for the next several months, we're going to be busy with planning and recruiting, so.
I was going to mention that I was the person who made the motion to go to monthly meetings from the twice a month meetings. And I wonder if we should go back to twice a month meetings because of all the work that's in front of us for choosing a new director and then working on the strategic plan.
Okay. Other members' comments? So, personally, I think monthly would be, from my standpoint, monthly would be appropriate. Do we want to just keep the third Wednesday of the month? Is there a different day that fits better?
This is Jess. I would support monthly and keeping the same time.
Okay.
I'm flexible also.
Okay. Well, and I think, you know, our bylaws do allow that if there is a need for a special meeting, the chairperson or any three members of the board can call a special meeting. So if we do have something that we need to tend to on the recruiting, or we can up our frequency and call them special meetings. So,
I think that's a good idea, Tom.
okay. So if we stay with this schedule, our next meeting would be February 3rd Wednesday. Where do you find a calendar not on the computer?
16th, February 16th.
February 15th?
16th.
16th. Okay. All right. So should we plan on monthly, third Wednesday, 6 o'clock? And as far as I'm concerned, you know, Zoom works well. If the numbers do come down, I think we can take another look at it. But for right now, I think this is serving us well. So 16 February, 6 o'clock p.m. Okay. Ann McDonough, do you have any comments, questions from your seat on the Board of Supervisors?
Thank you. Good evening, everyone, and welcome new members. There's some things that I think that I'd like to say and comment. Obviously, I appreciate everyone's time. There's a big task before you, and I would ask you to ask the Board of Supervisors for help. Under the Iowa Code, you definitely are a separate board. You have your own budget. You get to make lots and lots of decisions. No one's trying to interfere with that, but this is a new board. And you're hiring a new executive director. You're asking about what should this department be? Ask us for help. You don't have to create a strategic plan. I've offered this before. You can have a facilitated conversation, someone who asks those questions that draw out discussion. Like you're going to move ahead with a job description. Who are you hoping to hire? Somebody who's growing a department, someone who's running a lab, that does water testing, someone who's going to manage 2 people, 4 people. I think there's so much just discussion and conversation that I, as one board member, really need you to have, that and it's hard to have that here in public without someone who's facilitating that and who is kind of drawing out what you kind of need to see. So, you know, who your next executive director is going to be, some people won't apply for this job. The person that you want may not want a job supervising 1.5 people. So what is it that you need to hire? And you're all professionals. You've all done this at high executive level, try to recruit, try to hire people. So that really is, I think, the task before you. So we can be helpful to that. There is funding if you ask for it. There likely is funding to do this. So, you know, the other departments that you've spoken to, do they all have labs? Do they do water testing? When I had some email exchange with Adam, I had thought maybe there'd be uniform questions. You were asking every department, you know, did we ask all the same things? So if there's something we can do or I can do to help facilitate that or draw down the information, we have people that will help with that to try to do some more of the background work while you have a very understaffed department. So, you know, I would just ask you to think about the Board of Supervisors and my team, our team, as helpful to you. Dawn Sherman is a fantastic HR person, and she'll get you through this well using her resources. Tonight, earlier on this meeting, the director of our disability services and mental health coordinator, Dr. Ann Cameron Williams, was present. I've asked her to kind of listen in now to see how we can bring to bear the other departments that public health probably will work with, depending upon how you design this to be. So there, I mean, it is a time for citizens want to see where you might lead us. But you know, that's a job that just has to be done. And you are the group to do it. So, you know, I just would not want, we are a resource, whether or not, you know, we are called on when our hand is raised here at the meeting. We can help you. If you ask us, we would be glad to assist.
Thank you, Ann. Okay. At this point, I would ask anyone who wishes to address the board on matters which are not on the agenda to please raise your hand on Zoom, state your name and address. Be aware the board is limited in their ability to respond, as Iowa Code prohibits the board from deliberating or acting on items not appearing on the agenda. Individual comments will be limited to 3 minutes. So is there anyone who wishes to address the board? Let's see. I am not seeing any hands raised, nor do I see any little red or little blue hands on the board. So I guess I would ask at this point, do we have a motion to adjourn?
I'd motion that we adjourn.
Thank you. Sandra seconded.
Yes.
Samantha?
Amy,
Aye.
Marcia,
Aye.
Jess,
Aye.
and Tom. Oh, did I skip Sandra?
No, you didn't, Sandra.
I think I said aye.
Okay, sorry. Tom.
Aye.
Okay, 5-0, motion carried.
Thank you very much, everybody.
Have a good night, everyone.
Aye.
Thank you too.